It is Wednesday, and that means it's time for Morning Rounds.
And this morning, Dr. Robert Dichmann, founder of Mission for Hope's Cancer Center, is joining us to talk about the center that is under construction in Santa Maria.
That's right. Good morning, Doctor.
Morning. Thanks for having me.
Well, thanks for joining us this early in the morning.
No problem.
So tell us about the Mission Hope Cancer Center. What is that all about?
Well, Mission Hope Cancer Center is a new building that we are just finishing up, should be finished by the end of January, and that's going to be located on the campus of Marian Medical Center.
Okay.
It really was started many years ago, but it's taken a long time, obviously, to get the project through. But what our goal is really is to make a center for cancer patients to come in and receive all of their care, whether it's diagnostic from CAT scans and PET scans to lab work, basically have one facility where everybody can get their care.
And how did the Mission Hope Center become a reality?
Well, it started really with the drive of patients more than anything else. Just after years of working here, we really started asking the patients what they needed in terms of easier access to care, and that's really how it all started, with patients telling us that it's very difficult to go to different locations all the time, particularly when you're getting cancer care, because we're beating them up a little bit with our treatment.
So it's almost kind of a one-stop shop, if you will?
It is a one-stop shop. We will have everything from, diagnostics to their actual treatment. So there should be very little reason for anybody to go outside of the building to get their care.
So how many years has this been in the works?
Formally, probably about 5 years or so. In the thought process, probably 8 years or 9 years before, but certainly it's taken the last 3 years of starting construction and doing the financing and whatnot.
All right, and what can the community expect from Mission Hope?
Well, the most important thing, I think, for us is to deliver that care that we want. And so they should be able to go in there and essentially have everything done. So from the lab work that they need initially. Patient care for cancer is different in the sense that there's always multiple doctors taking care of the patients, not just one. So we will now be able to work much better as a team taking care of those patients rather than them being scattered various visits around the various locations in town. A lot of patients are getting 2 types of treatment, chemotherapy and then radiation therapy, the same day. Currently, they have to get back in their car and go from one location to the other, sometimes several times. In this case, it'll all be in one facility. Much like the same way that we have organization in UCLA or Stanford, those kind of things. And we'll be able to bring that kind of technology in this new facility.
Now, when will it be completed?
Our goal is to finish construction at the end of January, and so we should be seeing patients in February sometime.
Wow, that's great.
Right.
So it's coming soon.
Perfect. And how big is the need for something like this in the community?
I think it's very big. Our population's growing. Most of our population that's growing is the senior population, so cancer is something that we're seeing more commonly. And the truth is, this is the way we need to deliver cancer care. We're strongly affiliated with UCLA, so that we're have a strong research department now, and that's a big part of what we do, and we have those connections established so that our goal is that they are getting the same care that they would get at a big center in a big city. And I think we've been delivering that, but this is going to be even better all in one location. So that's the goal that we're trying to achieve.
Excellent. Very good. Well, if you have a question about your health, send it to morningrounds@kcoy.com.
Thank you so much, Dr. for joining us this morning, and we'll be right back.